All right. Hi everyone. Welcome. Welcome to tonight's stream. I apologize if my voice still sound a little bit weird. First of all, I'd like to thank everyone who left me comments and wish me feeling better. And I think I'm about 80% back to normal, and I still have some mucus and cough at night. You may hear me try to grab my breath throughout the stream. I may cough a little bit. I apologize ahead. But that's not the focus tonight. So let's not focus on my condition tonight. Tonight, I really want to chime in on one of the most discussed myocarditis autopsy paper published by German researchers. I'm sure if you watch other YouTube doctors' channel that you may have already watched this topic. And so, in addition to this paper, I also want to discuss a few other papers that have updates on the latest on the myocarditis risk and when we can expect to know more about this topic. So we're looking at about 4 or 5 papers, brief discussion, 4 or 5 papers. So it may be a little bit longer than my past stream. So just keep a note of that. Um, all right. So without talking too much small talk, let's just have a very quick recap. Now, myocarditis or pericarditis, sometimes people link two terms together, myopericarditis, is a recognized rare side effect associated with COVID-19 vaccine, more so with Moderna than Pfizer. Okay, this has been confirmed with multiple study, and let's look at this. All right. This one. Okay. So this is a study that was published very recently, November 15th, in the Journal of American College of Cardiology. We're not going to go look into the detail of it, but this does have a very good graph, shows you that myocarditis, it associated with all age groups, okay, all age groups from vaccine, more recognized in boy teenagers to men under 30 years old. So this red bar, and significantly with Moderna, probably because of the higher dose, okay, in the Moderna mRNA vaccine. Right. So this is a fact. Now let's look at this German new study here. Just very quickly look at what this study is about. Now you look at autopsies, okay, dead people's tissues, 25 of them who died unexpectedly and within 20 days after COVID vaccine. 4 out of the 25 autopsy were believed to be a direct result of acute myocarditis, and without seeing any other significant disease or health conditions that may have caused their unexpected death. Now, but one of them, okay, one of the four does have a low level of human herpes virus 6. So that could be possible. So that left us 3 cases of very likely uh, cause of death. Now let's look at table 2 here, the characteristics. All right. So uh, none of them, very clearly, none of them, okay, the 4 cases, none of them had PCR analysis or confirmed cases of COVID-19 infections. None of them had that. And the 3 most likely cases were from both gender. We have male, female, male, all right, age from 46, okay, 50, 55. So they were not in the age group, okay, that where COVID vaccine associated myocarditis is most often seen. They're not the male under 30 years old. 2 cases also had only received first dose of the mRNA vaccine, both either the Pfizer or the Moderna. All right. Okay, so that's the patient characteristic there. Now, and this is, a lot of graph is shown. So basically, without going too much into the histology there, basically they do the sting, they find T cells infiltrations in those heart muscles. And we'll look at some of the discussion points coming up, okay? Now, um, basically, in their author's own word, okay, during the last 20 years of autopsy service at the Heidelberg University Hospital, we did not observe comparable myocardial inflammation infiltration. So this is has never been seen, according to them. All right, and they provided some very good explanation of why they think there is a causal link between myocarditis and the anti-SARS-CoV-2 vaccinations. And number one, there's a close temporal relation to the vaccination. All cases were found dead within 1 week after vaccination. So the time component. Second, none of them had any other significant pre-existing heart diseases, especially ischemic heart disease, okay, or any type of cardiomyopathy. What does that mean is their were normal before their unexpected death, okay, and they were negative tests for any potential myocarditis causing infectious agents that include SARS-CoV-2 and other viruses that known to cause myocarditis. So they ruled it out. And they also saw presence of CD4 T cell in the heart muscle, which was not supposed to be there. So in other words, these three cases were likely the direct result of vaccination. All right. Now, so I don't know if you watch any Sherlock Holmes or you read about Sherlock Holmes. There's a very famous quote. I don't know if you're thinking what I'm thinking. When you have eliminated all which is impossible, then whatever remains, however improbable, must be the truth. I think that sums up, right? Um, what is more important is that there was always a debate about how far the vaccine component travel beyond the deltoid injection site, right? We always say that, hey, we always believe that, right? The vaccine went into the deltoid and stays in the deltoid, stimulate immune response in the deltoid, and that's all, right? That was the assumption. What do we know now? Okay, so in one of the case, the same CD4 helper T cells were found in both the injection deltoid muscle site and also in the heart. Okay, they are phenotypically identical, right? Now, CD4 cells, okay, they are different cells. Okay, they are different than the cytotoxic T cells. They do not kill virus infected cells, but they have a role in stimulating other immune cells to fight infections. So we call them CD4 helper T cells. Now, sorry, why was the CD4 cells in healthy heart muscle? Well, it was supposedly healthy, right? There were no infections, first of all. Okay, they weren't trying to fight infection. So this suggests that the vaccine stimulated immune responses in organs that was not supposed to be. Okay, at least in that one case. Or at the very least, we can say that most of the scientific community, including me, at first when we're looking at the mRNA vaccine when it first being released, did not think mRNA vaccine would stimulate immune responses, particularly in the heart. That was what was believed. And this piece of evidence, this is very hard evidence of autopsy, direct observation, see that that changed that assumption. Now, I'm just a little bit surprised that this paper is not discussed much in mainstream media. Like several of us discussed on YouTube, but that's about it, right? Now, just to be fair, okay, this is one case, okay. We're not saying that every single case is like that, okay. This is one case. We don't know why it happened. But if I were to speculate a little bit just based on my knowledge in immunology, it probably has something to do with individual immune system differences, those HLA, presentations and all these. And some people have a more reactive immune system than others, and the mRNA platform may be too much for them. You're not supposed to mount an immune response at the heart, right? when there's particularly no infections. So the question, okay, right, always revolving around risk versus benefit. The official message continues to describe that the risk of myocarditis is higher from COVID infection than from COVID vaccination. So it is worth to get vaccinated because you will get myocarditis from infections. That's the always the narrative that we hear. Now, since we've been talking about mortality cases today, let's look at this, question, this problem from another angle. What is the difference of dying from COVID vaccination associated myocarditis, such as what was presented in the German study? What is the difference between that and the risk of dying from COVID infection myocarditis? Right? Someone got COVID um, and got myocarditis and died from it. What are the differences there? Okay, so let's look at a different paper here. All right, so this is also a very new paper, just got published in this month issues of Journal of the American College of Cardiology. It's a prognosis of myocarditis developing after mRNA COVID-19 vaccine compared with viral myocarditis. All right. Now, so this paper was from a group of Hong Kong researchers. Like so, in they look at the time frame over 180 days, okay, or 6 months. Now, just to very briefly, summarize, the results that they had is that about 1% of their studied population, so 1 out of 104, okay, died of post-vaccination myocarditis, according to the study, and 84, which is 11% of the 762 patients would died of viral infection related myocarditis. So this is not a huge study, but they said, well, adjusted analysis say that post vaccination myocarditis group had a 92% lower mortality risk. Now, unfortunately, I do not have full access to this article, so I could only read what was presented in the abstract, and I don't know exactly the patient case details, their age, their conditions. But there is a supplemental article that was published or written in a medical news journal called Medscape, for pharmacists. Here, this one for pharmacists, which I subscribe to, and where it talks about some of the a little bit of the details of this studies. So, according to this summary article, it says that the patient's cardiovascular health status was better in those post vaccination myocarditis than those post infection myocarditis group. And that may explain a higher observed myocarditis death in the post infection group. Okay, what it means. Now, in other words, people with underlying medical conditions are more likely to have post infection myocarditis than those without. So, the benefit, okay, of vaccinating these people is higher than the risk. This is quite clear. This is pretty consistent with a lot of different research, not just from this research. So what about younger population, right? There's always the debate about the younger populations. And we have another very brand new study here. Right, so this is a systematic review meta-analysis study. Okay, now so it is a summary of a summary. Okay, and analyze different studies from 23 different study and look at the myopericarditis after COVID-19 mRNA vaccine among adolescents and young adult. Okay, so they are younger. They look at 23 observational studies. They identified 854 individuals with COVID-19 vaccine associated myopericarditis. All right. And they were from age 12 to 20 with an average age of 15.9. So there's a very, very young people. Okay. So they said that 92.6% of the 854, okay, individuals were hospitalized. So that's a lot. About 9 out of 10 were hospitalized. And out of those, about 23.2%, so about a quarter of them, were admitted to ICU. Now, there were not much drug were used in these patients, but they were in ICU. I wouldn't say that when a young person, okay, with the average age of 15.9 admitted to ICU because of myocarditis, it's something mild. Even though the case, there were not a lot of cases, certainly we cannot say everything was mild. Now, this paper continue, okay, to say that um, it is favorable. Okay, continue to say that vaccine is still favorable because COVID infection causes more cardiac complications than vaccine. Right, so this is the norm, the narrative of the norm. We always hear that. So we need to question ourselves: is this always true? Is this always true? All right. So I can put at least one study arguing that is not always true. And now, so here is an older paper published in August 22nd in Circulation. So that is a big study. I think this is from some populations from UK, if I remember correctly. Yes, probably yes, because they were given adenovirus or the AstraZeneca vaccine, and none of them were in the US. So they looked at 40 more than 40 million people. Okay, so this is a very, very large retrospective observational type of analysis, bigger, way bigger than the meta-analysis that we just talked about. And without going too much into the detail, what is new? Okay, here is a very important statement here. For men less than 40 years old, okay, when they get the second dose of the Moderna vaccine, mRNA 1273 is the Moderna, the risk of myocarditis was higher after vaccination than SARS-CoV-2 infection. So this statement states very clearly that um, the the narrative of COVID infection caused more cardiac complication than the vaccine is not always true. It's not always true. Now the question gets even tougher when we look at subclinical cases of myocarditis. All right. So here is a type of an interviewing type of a article that was published in Science News article. So still a very good source of information here. And according to this article, this researcher, Dr. Christian Muller, okay, a director of the Cardiovascular Research Institution at University Hospital of Basel, okay, he collected, okay, 800 samples of blood samples from 800 hospital workers 3 days after they got their COVID-19 boosters. So presumably, booster means the third dose, okay, presumably. And out of the 22 samples of the 800 samples, he saw a raise or increase in troponin level. That is 2.8% of the participants here. Now, raise in troponin level means there is indicative of a subclinical myocarditis caused by the vaccine. Something happened to the heart and it caused a raise in troponin. Okay, but maybe they're not symptomatic. They still feel fine. Okay. Now the good news is that the troponin levels were quickly fell to normal, so there was no significant complications afterward. Okay, that is good. But according to him, he worried about the potential cumulative effect of annual boosters. Right at this point, we don't know what would be the effect if you keep boosting every 6 months, every year. Okay, what would be the effect? Now, just to go along with that, report, a different study, an earlier study, looked at 1,600 college athletes. So those are the young, healthy individuals. Okay, they found that about 2.3% had either clinical or subclinical myocarditis after getting the COVID infection. Okay, so this is about the same. So after infection in healthy young individuals, you get about 2.3% of some type of a myocarditis, and in about the same 2.8% of the people, okay, getting the COVID-19 booster, presumably they are relatively healthy and young, they have subclinical myocarditis. Okay, um, that is a comparable number again. So here are just two examples showing that uh, for the risk and benefit analysis for the older population, for the vulnerable populations, more precisely, it is very clear cut. The vaccine save them, save lives. Okay, but when we are looking at when we are trying to, move the age group, to a younger population, the narrative, somewhat changed, somewhat changed. The myocarditis, the carditis risk, it's really always it's going to be debated, and then you ask me, okay, so is the government doing anything, right? Is the government asking the industry to do anything? All of the research we looked at is from academia, and they have limitations, being small sample size. They're mostly observational. Okay, are there any trials to study that? Okay, just to be fair, all right, the FDA is doing something. Okay, now this is a approval letter for the Pfizer vaccines. You find similar information for the approval letter for the Moderna vaccine. The FDA in their letter issued to Pfizer request, okay, or required both of the manufacturer to conduct studies to evaluate the occurrence of myocarditis and pericarditis following an administrations of their respective vaccine. And here is the timeline of when they need to submit their report. So they should be, or they should be doing some type of study right now. Okay, according to the timeline, and in a year or so, they should have some interim report, and in about 2.5 years, their study of myocarditis and pericarditis should be complete. Okay. And they need to submit their final report by October 31st, 2025. Now, I know it is a long way from now. So it'll be a little while before we know more from the industry standpoint. I'm sure, meanwhile, the academia researchers will always be studying these things. Now, clearly, we have very different narratives sometimes, and reputable research shows that it is not always, for all population, we can say that the risk of myocarditis is higher from infection than from vaccinations. So when that is the case, shouldn't the officials re-examine some of the recommendation for healthy young, particularly males, right? A lot of the European countries are changing the narratives, right? Or have already changed the narrative. They want to stay, they're saying that boosters are more reserved for the high risk younger population than for every young populations. So we have not seen that here in the US. Uh, Canada, I don't think there's any changes in recommendations. Um, so that is something to be, to be think about, right? To be thinking about. So, just to summarize some of my thought here, we've talked about a lot of things tonight. We're 23 minutes in, but I'll be quick. So I'm disappointed in a way that we always put out this blanket statement that vaccine benefits outweigh the risk. Um, and it is very difficult for individual to look into the detail. Well, we can either trust all these official statements or go in to look at the studies. And it took me a long time to look at all the studies, and I try to share with my findings with all of you on YouTube. Um, and what I've seen so far, the vaccine, you ask me, do I think it saves lives? Definitely, it saves lives for vulnerable populations. Okay, that's no doubt. The risk of dying from COVID is significant for these people. But as we move the age bracket to younger, healthy population, the individual health benefit gets smaller. Okay, it's also gets more difficult to analyze with additional boosters as well. Someone could argue that there is a public health benefit if every one of us gets the vaccine. That is true when a vaccine can effectively prevent transmissions. So far, that has not been the total case, right? With vaccine antibody waning, with new mutations, new variants, subvariants coming up, that has not been the case. And also, the CDC emphasized that the goal for the current vaccine is to reduce individual hospitalizations and death. All right, so the public health benefit piece of information has has not been firmly established, as far as I'm concerned, with whatever we have so far. So just to sum up, I think it is, sometimes a catchy, it's a catchy subject to talk about risk, legitimate risk, okay, legitimate vaccine risk in front of the public these days. California, we have a law, right, to punish physicians to spread some information. We've seen some prominent cardiologists from UK, from US, I won't name them, being banned or canceled. And, my YouTube colleagues and I sometimes risking our channels to talk about this, I think. But I think if none of us, try to break down these studies for the general public and explain legitimate scientific risk of the vaccine, then how can the public be able to correctly weigh individual risk and benefit, right? So none of these, whatever I talked about, was conspiracy. Everything is published, peer-reviewed paper, and they illustrate a given amount of risk. It is rare, but it's there. All right. So I think that's what I want to bring out. I don't know if this video will get a strike or not, but for those of you who have been watching this whole time during the stream, I hope you learned something and be able to make health decisions. Again, all of us here, I'm sure all of us here that are listening, trying to learn more about the vaccine, are legitimate people that are concerned and care about the subject. And I'm pro-vax. I personally weigh my own risk and benefit. Okay, and I have 3 doses. All right, so uh, that's the reality, and uh, everyone should be able to think for themselves. All right, so with a little bit uh, time here, I saw some of the comments. So certain topic, brought up there. Breast milk, mRNA in breast milk, mRNA got changed or got integrated into genomes. Those topics I've talked about in the past. Okay, I'll try to put the link in the description box after this video streamed. Again, it was not expected, right? A lot of the things, and we find out otherwise these days now. So, thank you for everyone that has been sticking around, and I hope my voice is okay. I'm surprised I didn't cough. All right. That's all for tonight. About 30 minutes now, and thank you very much for staying around and look and listen to me. And I will see you again in my Sunday videos. That's probably not going to be COVID, but some other health topics. All right. Take good care and have a good night. Bye.